There's new research from Oxford University that has found that teenagers who suffer moderate or severe period pain are more likely to experience chronic pain as adults. It's a study that was published in the medical journal The Lancet. It looked at data of more than 1,000 people, included in the Avon longitudinal study of parents and children, also known as the Children of the 90s study. The researchers found that the participants with severe period pain at age 15 had a much higher risk of experiencing chronic pain at age 26 than those with no period pain. Well, here to tell us more about the study, also what it means, Professor of Gynaecological Pain and Consultant Gynaecologist, Dr. Katy Vincent. Welcome to Women's Hour, Katy. Good to have you with us. So I give a couple of the top lines there, but explain it in a bit more detail for us.
So thank you ever so much for having me on this morning. So exactly as you said, we were really interested in whether teenagers experiencing period pain who hadn't experienced any other kind of chronic pain before that, so nothing that had lasted for longer than 3 months, which is our definition of chronic pain, whether they would then go on to develop chronic pain as a young adult. And we know that chronic pain, once it's set up, once it's established, is really hard to treat. There are at least a quarter of the female population living with chronic pain at any time. So we were interested to see whether actually your first experiences of pain as a teenager might be a predictor of that in the future. And that's exactly, as you said, what we found, that those with severe period pain at 15 were 76% more likely to have chronic pain at the age of 26 than those who didn't experience period pain at all. And those with moderately severe period pain were also much more likely to have chronic pain at 26 as well.
I suppose my first question is, and anybody who's had period pain will understand this, but how do you quantify it, moderate or severe period pain?
That's a really good question. And in research studies, we often use scales like from 0 to 10. But we are aware from some other work that we're doing that actually teenagers find it quite hard to conceptualize those numbers. Mm-hmm. So actually, we didn't put the questions into this birth cohort. You mentioned we used the Children of the 90s. So that's a birth cohort that's been giving these questionnaires out. The puberty questionnaires were given out every year. So those questionnaires have been kind of well used. But the questions that they use kind of gave an explanation of those definitions. So moderate was the type of pain that you found it hard to ignore, even if you were doing something, whereas severe pain was pain that stopped you from doing the things that you would want to do. So it was conceptualized in a way that teenagers and their mums would be able to understand.
You know, I read out one listener's comment there about fibromyalgia that she has suffered with, and she's convinced there is a link. But what sort of chronic pain are you talking about that people may suffer from?
And I think this is why this is so important. So we did know that from some other studies that period pain often precedes other types of pelvic pain and can be a predictor of things like endometriosis. But what we saw was that actually this is pain throughout the body. It included headaches, jaw pain, joint pains, wrists, hands, knees, back pain, hip pain, for example. So it isn't just located to pelvic pain.
What is the link?
Well, that's a really good question. And we do have some other work still going on within this project to try and explore what the mechanisms might be. We had two potential theories. One was that we know that having period pain as a teenager is associated with increased rates of depression and anxiety later in your teens. It interferes with so much of social development and schooling and so on. So we wondered whether mental health might be a mechanism, and we were able to explore that with the data that we had, and we could see that actually that only explained a really small proportion of the relationship. So definitely we saw more depression and more anxiety symptoms in girls 2 years after they'd started to experience period pain, but that only explained a small amount of those going on to get chronic pain. So what we think is most likely the explanation is that your nervous system is changing all the time, but it changes an awful lot during adolescence. It's a time of real development in the nervous system. And we wonder whether the experience of having repeated episodes of pain is actually enough to kind of turn up the volume on the pain sensing system and change the way that the nervous system responds to pain, therefore making you more likely to develop chronic pain in the future.
Couple of comments coming in. I'd be curious for your thoughts on it. Awful period pain as a teenager, really dreadful. Continued on into my 20s where it got worse and worse. Finally, in my 30s, when trying to have children, it was discovered that I had one ovary that was badly mangled and another one that was tiny. My mother dismissed period pain as something we all had to go through, but it's so important to try and find the reason behind the pain as young women. Another, Pauline gets in touch. My daughter, age 17, has crippling period pains. It has her curling up desperately, unable to do anything. We have used ibuprofen, hot water bottles, tapping her back, handheld massager over the abdomen. It's a very difficult issue and we try to just work through it. We always talk openly about these issues as it is otherwise so isolating for her. So we're seeing definitely a change in generation there in the way that they're dealing with it. But what about somebody who's a teenager who has very severe or moderate period pain? Because obviously people want to avoid chronic pain at a later stage. What are you advising?
Well, I mean, that's part of the reason that I'm delighted that this study's getting some exposure, because I think the most important thing is to get the message out there that period pain matters, that we should take it seriously, that you shouldn't have to put up with it, and that there are treatments available. And we know that actually the majority of teenagers with period pain don't even present for care. So it's not just a problem that doctors aren't treating them, it's actually that they're not coming forwards to be treated. And we have heard over the last couple of years of various schools around the country, for example, saying that you can no longer miss school for period problems, that you need to sort of man up and learn to live with these symptoms because it's part of being a woman. And we really want to kind of change that message and say, actually, you shouldn't have to put up with it. There are things that we can do about it. So rather than saying, don't come to school, put up with it, it's go and seek treatment so that you can come to school without this interfering.
Yeah, and I guess I'm just thinking, as you're speaking there, it's about treating the symptoms, do you think? Or is it possible to get to the cause of why somebody has period pain compared to somebody else?
I think it's a bit of both. So what we saw in our study, which aligns with lots of other work from around the world, was that about 60% of our population were experiencing moderate or severe period pain. That's incredibly high numbers. And we know that things like endometriosis, for example, we know that that only affects about 10% of the population. So a large proportion of those with period pain won't have any underlying cause. We don't completely know why they experience these symptoms. Maybe their womb is more sensitive to the contractions. Maybe their bleeding is a bit heavier. Maybe there's more inflammation going around, but it's not anything specific in terms of a diagnostic label. So in that sense, yes, I think it is a symptom that is of itself deserving of treatment. There may be a smaller proportion who have an underlying disease that in the future we need to identify, but I would argue that our priority is just getting on top of the symptoms to start with. And obviously those who don't respond to kind of initial treatments should be referred on into secondary care and see a gynaecologist, but most of this can be managed in the community, and that's a much quicker route to getting care. We know how long gynecology waiting lists are at the moment.
We do. Professor of Gynaecological Pain and consultant gynaecologist Dr. Katy Vincent, really interesting. Thanks so much for joining us.